Hello, everyone. First, thank you to the organization at AI for Health. The conference is really well organized, and thank you for being here. So I'm Adrien Guénégaud. I'm a medical doctor trained in France, specializing in radiology and endovascular neurosurgery. And I will present you today a new project I have for 1 year. So I'm only part-time in medical stuff, and now half of my time is dedicated to Radiologues, which is not launched yet, but will be launched in January 24. So you're gonna wonder why a new radiology AI stuff, because there are already plenty on the market. Well, we think as radiologists that there is still some gaps between the AI tools that we have, the patients, the physicians, and so there is still a lack of trust and a lack of connections between all these worlds. So what we want to provide is basically second opinion, and then we'll have AI tools later. So I will just start with a brief story, because all of you, probably you know that the medical market is pretty difficult, and when you want to do an MRI, a CT, you will still have to wait for weeks, months sometimes, and you don't even know who is going to interpret your image. And whatever is your medical problem now, at some point in your life, you will have medical imaging. You will have a CT, radiography, or an MRI. The problem is this exam will be the basis of everything after that. So if there is a misinterpretation of the imaging at the beginning, then everything else will be false after that. So you have a risk of misinterpretation, you have a risk of problems if your doctor think that you have a pathology you don't have because the radiologist at the beginning didn't do the correct diagnosis. So for example, when I was younger, I was doing a lot of sport, fencing, and I had a knee pain, so I went to see my general practitioner. He prescribed a CT, then an MRI. So the exam were interpreted by general radiologists, and they said, okay, there is a bone lesion. You have to see a surgeon. The surgeon said, okay, there is a bone lesion. We don't know exactly what it is. You will probably have something like bad, so we need to operate. Like, okay, I'm 15 years old. You need to do like a big surgery of the knee, remove a part of the bone. So it was not that convincing. Fortunately, my parents knew specialized radiologist in bone imaging, and so I went to see him. And at the time, second opinions were pretty difficult. It was 2000 something, so you had to print the images of the MRI, of the CT. You had to go to the doctor, give him the images. He looked at it and he said, okay, well, we will do other exams, but it's not like a tumor. It's probably just a very rare form of chronic fracture. So because you do a lot of sport, you're young, that's it. And we did the exams, and that was it. It was just a chronic fracture. And after a few months, everything went fine, and now didn't have a surgery, and I'm fine now, hopefully. So the thing is, everyone in the population doesn't have access to these specialized radiologists, and you still have to know that you need a specialized radiologist. Most of the people don't know that. And now, as a radiologist and specialized in neuroradiology, I think that there are some things that we could improve here. So that's the idea of Radiologues. The idea is to develop a platform where we are going to connect specialized radiologists with patients or general practitioners that need a second medical opinion in radiology. So the idea is you have an exam, or your general practitioner has help you to give you the access to MRI or CT. You have the exam and you're not completely happy with the results, or your general practitioner thinks that you can have another opinion. So the idea is that we are going to connect you with the right radiologist. That's our first tool. And we gathered the radiology team, and now the platform is nearly ready to be operated. What we are going to do with that is we develop in-house tools to help the radiologist to describe your pathology and give a better information to the patients. Because if we connect you with a specialized radiologist, but you receive a report and you don't understand it, then what's the point? So the idea is to give you this specialized report, and on top of that, you will receive complete information on your pathology that will be really easy to understand and that will lead you to the next steps. So it will tell you what is the prevention for this disease, how you can tackle the next exam, what you have to do, is it something that you have to look at in your family, everything. So the idea is to give you the expert opinion and give you the very good access to easy information. So that's what we are going to do mainly. And then after that, our idea is to develop AI tools that will be used by the experts on our networks. So we will use the data of the patient that go into the platform to develop our tools later. So for now, as I told you at the beginning, we are not launched. We will be launched in January because we still need to work with the lawyers on specific things. But the idea is to launch the platform, so second medical opinion first, the AI tools for the information, and then using all of this, we will create new tools and specific ones for radiologists. First, we will use them for our radiologists in our network, and then we will try to expand and give the access to these tools to other radiologists in France. So for now, we will be based in France, and we will try to expand to Europe later. Thank you so much. And if you have questions, don't hesitate. We'll have like 3 minutes, so if you have questions, yes. For now, the business model, so the patient, it's outside of the national security, social security in France. So the patient for now will have to pay for the service. What we want to do is to go to the private insurance and try to make that the private insurance reimburse this second medical opinion. Because the idea is, if we give you a second medical opinion in the literature, we change the diagnosis in about 20 to 25% of the cases. And we manage to avoid like unnecessary surgery, unnecessary hospitalization in 15 to 20% of the cases. So it's a lot of money that the national social security and private insurance can avoid to lose for nothing. And even for the patient, I mean, if you don't need the surgery, you don't want surgery. So the idea is first the patient, and then we go to the private insurance so they reimburse it because they have something to gain long term. Yes.
Thank you. What is AI doing?
So the AI, we are working on it first. As I told you, I think there is a lack of connection between the two worlds. So we gathered the expert team of radiologists, and then we will give them tools. So the first tool will be a kind of easy access to large language models. So because radiologists, they are like experts in what they do, but they don't like to spend like 20 or 30 minutes to write an easy report that anyone can read, and that's something they don't like. So the idea is to give them a tool where they will just put their expert report, and it will provide them a report that is accessible to other people. That's the first one. And then using all of this, we have other ideas that we'll develop, but it's for later because we will need much more money and much more people to work on it. But the first AI tool will be an easy one. So we will use large language models to help them provide this access to this easy information. Yes?
I have a question. In order to give an interpretation of MRI of stuff, you need a clinical context.
Yep, correct.
So the patient has to enter also the history of disease and stuff in your software?
Correct. So we have a platform, and this platform is basically exactly the same kind of platform that we already use for classical teleradiology. So the patient has to enter the medical examination he did, like if he did an MRI or CT, he will just enter it, send us the images. And we, for each type of disease, we will ask a series of questions that are specific for this disease and specific for each doctor that will interpret the images. So the idea, of course, is to mix images and the context and the indication, because without the indication, it's really difficult to interpret it.
Do always have the right answers that you want in this context?
Time is off.
Yeah.
We need to, so if you can discuss
Yes,
after
later.
that.
So
Sure.
we can meet later. Not yet, but